So Tyreek Hill came out with news yesterday that he's been playing through a wrist ligament injury. There's a couple different things that could be, and a lot of people would wonder if it was a scapholunate ligament injury like what Joe Burrow had, and that's not the case. You can't play through those kind of injuries. It really destabilizes those two large bones right beneath that green ligament there, called the scaphoid and the lunate, and it would be extremely dangerous for his future playing career for him to try and play through that. It's much more likely that he has a distal radial ulnar joint ligament injury or an injury to the TFCC, the triangular fibrocartilage complex injury. So it's basically comprised of that ligament up there. It's comprised of the distal radial ulnar ligament right there, the dorsal side. There's also one on the volar side, so two sides of the wrist. You'll see it come up here. Other than that, how's your day going? So yeah, there's the palmar side right there. And then you also have possible injuries to the disc, which is right above that ulna bone right there. And then it can also be an injury to the ligaments that connect the ulna to the lunate as well, or the radius to the lunate. It's called the radiolunate ligament. Right there. Now, when you have an injury to those ligaments, you can see a destabilization can happen between the radius and the ulna. That's only in severe cases. It seems like Tyreek Hill has a grade 1 inflammation sprain. Otherwise, you wouldn't really be playing through this. We talked about before how scapholunate ligament injuries you never want to play through. You can play through Druge injuries or TFCC, cartilage complex injuries, without too much of an issue as long as it's only a grade 1 with inflammation. So if you see these kind of imaging findings on x-ray, you're not playing through that. This is a hallmark sign of inflammation right at that TFCC over that disc, as well as over the connecting ligaments over there. So you see that on MRI, that's a pretty significant injury there. So when you do need to go in for surgery, there's a couple different indications for it. So TFCC injuries are usually chronic injuries, basically meaning a lot of ulnar deviation repetitively over time, causing fraying of either those ligaments or that disc, and that's not really that greatly repaired by surgery. But in case of a sports injury like Tyreek Hill had, you can do a surgery on it and they actually regain the majority of their motion and grip strength. This is more so in the general population. For an athlete, they would have an increased rate of return and an increased percentage return as well. Here's a much more clear picture of the TFCC, regardless of how many words are on there. So you see that palmar dorsal radiolunate ligament, that's a part of it. You see the triangular disc right there, that's another major part of it. And then if you see right above me, you can see the ligaments that connect the ulna and the radius to the lunate bone. So that's the majority findings of the TFCC, as well as the Druge or the distal radial ulnar joint ligament. So now that brings us to what can we expect from Tyreek Hill going forward. So the best way to compare that is by looking at how other players at the position have suffered from this injury in the past. We can reference only 2 wide receivers that happened in the past 6 years that presented with a distal radial ulnar joint injury or a TFCC injury. That was DeAndre Hopkins, who actually was a beast and was able to play through it without any kind of significant limitations. He eventually did take time off later on, but not before he finished the season with 1,378 yards, 13 touchdowns, 96 receptions, not bad. Well, what about Michael Thomas? That happened a little bit more recently. He missed significant time, but the thing about that injury was that it was also compounded with his ankle injury, and that's the major reason why Michael Thomas missed a ton of time. So what's the take-home point with Tyreek then? I mean, I think that Tyreek Hill is going to be fine going forward for this season. I think he is going to require surgical repair at some point in the off season, but I think he's planning on playing through this injury for the foreseeable future. He scored a touchdown yesterday. It seems like he's doing okay. Symptom-wise, he did a WWE wrestling move for a touchdown celebration. These aren't really the things that someone would do if they were really worried about potentially undergoing surgery in the short term. In terms of if the arrest that happened with him was something that might have caused it. So if he was cuffed in ulnar deviation for a prolonged period of time, especially if they really wrenched his wrist to the ulnar side, then that could possibly aggravate that kind of condition. It can cause increased fraying, increased damage to those ligaments, and that would be the input that I could provide on that. In regards to other other kind of injuries it could be, because we talked how it could be a couple different injuries. They haven't really specified that's this type of injury. There's something called the collateral ligament injury of the thumb. And in the beginning of the season, he said that this was an aggravation of this injury from the beginning of the season. He had a thumb injury. So that's what makes me think that it could be less likely ulnar collateral ligament of the thumb, called gamekeeper's thumb or skier's thumb. So that injury happens when you're pretty much wrenching your thumb outwards. It happens commonly when you fall outstretched on your hand and your thumb splits apart. Repetitive injuries like a goalie, where they're consistently catching the balls that wrench their thumb backwards, or an acute injury like a skier, where they fall outstretched on a slope and take a huge impact injury to that. That would be less likely to be playing through, as it usually does require a period of immobilization and a thumb spica splint, which immobilizes the thumb, which is why I don't think it's as likely to be that. Now, he mentioned that it was a ligament injury, but he also mentioned it was an aggravation of the injury earlier this season, which was a thumb injury. So that's why I think maybe there's a slight chance he misspoke and he meant a tendon injury. So the extensor pollicis brevis is one of the tendons that is involved with the thumb. A way to test for it is to do the Finkelstein's test, where you put your thumb inside your fist and then you ulnar deviate your hand forward, and you should feel a little bit of a pulling feeling on this thumb region here that extends down to the wrist. But if you feel any kind of sharp pain, then we call that de Quervain's tendonitis, tenosynovitis, which is a significant inflammation of that tendon sheath. The treatment for it's pretty easy. It's actually one of the few conditions that the first line treatment is a steroid injection. If for some reason that doesn't work, then you can pursue other possible surgical options on top of physical therapy, but usually that's not indicated. So once again, these two conditions are a little bit less likely. I did neglect to go over treatment options that could be done that are non-operative for TFCC. So in the short term, you can do an injection at that TFCC joint. So ultrasound guided right into the joint. You flood it with a little bit of steroid, and that can provide some anti-inflammatory benefits, some pain reduction, and it usually does provide relief to a significant subset of the population. So if he is playing through that, I would expect that if it's causing him significant symptoms before they proceed to surgery, they will try an injection. Usually you want to do that under ultrasound guidance, as we've talked about before.